Hi, my name is Melanie, and I'll be answering these 5 questions from Maddie Jen. All right, number 1 is tell me about your professional pathway. What kinds of qualities make someone in this profession succeed? So first, I am in the field of occupational therapy. I'm currently doing a 3-year OTD program, but currently it only requires a master's for entry-level practice. And the kinds of qualities that make someone in this profession succeed is definitely flexibility, interpersonal skills, having a good knowledge base, and then figuring out how to work around that for people. It's a very client-centered profession, so someone with the same diagnosis may not present the same way, but we also take into account people's environments, what they do, and like the client factors of the person. So we would modify the environment or the occupation or the person, but it's a combination of all 3 of those things, so you really have to look at someone holistically, so it requires just being able to see people through that lens. Number 2 is what would you like other professions to know about what you uniquely bring to the table? So occupational therapy can be kind of hard to describe. It has physical components, social components, and emotional components. But something that's pretty unique to OT, at least in an acute care setting, is that we're one of the only professions on the interdisciplinary team that addresses medication management. We address cognition, vision, physical abilities, and we take all of that into account and then see how that practically looks in somebody's life after illness or injury. But medication management is pretty unique in the acute care setting. Number 3 is what values/ethics are important to you in your profession, and how does this align with your personal value? One of the big things about OT is a patient's autonomy. So I see that value in myself too. I think autonomy is very important, freedom, and just having the ability to engage in meaningful activities. So with OT, if it's not volitional, then it's not going to work very well, because volition is a pretty big component, and just like respecting that individual's autonomy. If they don't want to do something, we can't force them to do anything. Number 4 is, have you ever worked in an interprofessional team? Was there a time where your values did not align with those of a colleague? If so, what would you change in the future to mend that issue? So I have worked on an interprofessional team before. I've worked in a hospital as a patient care tech, and I've worked in the school system as in RBT, or registered behavior technician. And on that team, my client was a student. It was a 5-year-old boy who was nonverbal, and he had the special education teacher, the principal was involved, a BCBA, which was my supervisor, or the behavior analyst. There was a speech language pathologist, a physical therapist, and an occupational therapist all on the team. And I was the one that was pretty much with him day to day. He used to have a PEC book, which was this like picture exchange communication book. And it was like little laminated pictures that he would just tear off the Velcro to say he wanted something or try and communicate something. And the speech language pathologist really wanted him to stick to that book. But me and my BCBA kind of wanted him to transition to an augmentative alternative communication device, or an AAC. It's just in the form of an iPad, but it gives him a little bit more freedom, because we could just add new words whenever and teach him how to use it, and there would be the space to have so many more words, conjunctions, like pictures, people, than he would be able to have with a PEC book. So I was very much for it. The SLP was not for it. And as an RBT, it's not really my place to kind of contradict what the speech language pathologist is saying in a speech language subject, which is like her expertise. But the parents very much wanted the iPad. My supervisor very much wanted the iPad. So I just communicated to my supervisor kind of what I thought when I was asked, and I just knew my role in that was to stick to my scope of practice, which was just implementing what my BCBA told me to do. And they were able to work it out, and he did end up getting the AAC device, and he was able to expand his vocabulary a lot. I don't think I would change how I acted in that situation. I think it was appropriate for the role that I was in. Okay, and then number 5 is what qualities of individuals of this field can double as great strengths within interprofessional teams. Something we're learning a lot about in school is how to use like therapeutic modes. So like kind of it's basically just reading the room, reading people's emotions and being like, okay, should I be empathetic right now? Should I be directive right now? Should I be instructive or collaborative right now? But basically that is just good interpersonal communication skills, which I think would be valuable to any team. Thank you.